BCEN Test Prep Exam Booster. Question 1. In a multiple minus casualty incident, the triage tag for a patient with breathing 30/min, no radial pulse, and who does not follow commands is option A, green, minor, option B, yellow, delayed, option C, red, immediate, option D, black, deceased/expectant. The correct answer is option C, red, immediate. Question 2. A patient with a traumatic brain injury exhibits decerebrate posturing. This indicates option A, a damage above the midbrain, option B, a damage at or below the midbrain/brainstem, option C, damage to the cerebral cortex, option D, a positive outcome. The correct answer is option B, damage at or below the midbrain/brainstem. Question 3. A female patient of childbearing age with abdominal pain should always be evaluated for option A, ovarian cysts, option B, pregnancy status, option C, endometriosis, option D, PID. The correct answer is option B, pregnancy status. Stressed about your BCEN exam? We can take BCEN exam for you remotely and undetected. We always guarantee a pass and payments only after results. To send us an email, scan the code or tap the link in the description and let's get it done. Question 4. The preferred medication for rate control in a patient with atrial fibrillation and rapid ventricular response who has heart failure with reduced ejection fraction is option A, diltiazem, option B, verapamil, option C, metoprolol, option D, digoxin. The correct answer is option D, digoxin. Question 5. A nurse is caring for a patient with a suspected pelvic fracture. The presence of blood at the urethral meatus indicates the need to option A, insert a urinary catheter immediately, option B, perform a retrograde urethrogram before catheter insertion, option C, irrigate the bladder with normal saline, option D, prepare for suprapubic catheter. The correct answer is option B, perform a retrograde urethrogram before catheter insertion. Question 6. A nurse witnesses a colleague diverting narcotics. What is the appropriate initial action? Option A, confront the colleague directly. Option B, report the observation to the charge nurse or manager immediately. Option C, document the observation in the patient's chart. Option D, call the police. The correct answer is option B, report the observation to the charge nurse or manager immediately. Question 7. The initial fluid resuscitation bolus for a patient in septic shock, per surviving sepsis campaign guidelines, is option A, 250 ml of 0.9% normal saline, option B, 500 ml of D5W, option C, at least 30 ml/kg of isotonic crystalloid, option D, packed red blood cells to achieve a hemoglobin of 10 g/dl. The correct answer is option C, at least 30 ml/kg of isotonic crystalloid. Question 8. Which assessment finding is consistent with a flail chest? Option A, a crepitus over the sternum, option B, paradoxical chest wall movement, option C, a tracheal deviation, option D, subcutaneous emphysema. The correct answer is option B, paradoxical chest wall movement. Are you looking for BCEN exam actual questions? Visit our website pokerexams.com to access BCEN exam study guide with actual questions and answers. Scan the QR code or click the link in the description to get BCEN exam answer key today. Question 9. The hallmark sign of compartment syndrome is option A, pain relieved by elevation, option B, pain out of proportion to the injury, option C, absent pulse in the affected extremity, option D, pitting edema. The correct answer is option B, pain out of proportion to the injury. Question 10. A patient with a spinal cord injury at T1 is bradycardic and hypotensive. This is characteristic of option A, hemorrhagic shock, option B, cardiogenic shock, option C, neurogenic shock, option D, septic shock. The correct answer is option C, neurogenic shock. Question 11. The golden hour for acute ischemic stroke refers to the window for option A, completion of an MRI, Option B, administration of 4 thrombolytics, TPA. Option C, achievement of blood pressure control. Option D, initiation of physical therapy. The correct answer is option B, administration of 4 thrombolytics, TPA. Question 12. Which type of shock is characterized by decreased cardiac output, elevated systemic vascular resistance, SVR, and jugular venous distension? Option A, hypovolemic shock. Option B, distributive shock. Option C, cardiogenic shock. Option D, neurogenic shock. The correct answer is option C, cardiogenic shock. Question 13. The most critical treatment for a patient with heat stroke is: Option A, oral rehydration with electrolyte solution. Option B, rapid cooling to a core temperature below 39 degrees Celsius 102 degrees Fahrenheit. Option C, the administration of antipyretics. Option D, active external revarming. The correct answer is option B, rapid cooling to a core temperature below 39 degrees Celsius 102 degrees Fahrenheit. Question 14. A patient presents with cramping abdominal pain, distension, vomiting, and high-pitched tinkling bowel sounds. These findings are most consistent with: Option A, gastroenteritis. Option B, bowel obstruction. Option C, irritable bowel syndrome. Option D, acute pancreatitis. The correct answer is option B, bowel obstruction. Question 15. A patient with a Glasgow Coma Scale score of 8 requires what immediate intervention? Option A, pain medication. Option B, intravenous fluids only. Option C, immediate endotracheal intubation. Option D, a neurological reassessment in 15 minutes. The correct answer is option C, immediate endotracheal intubation. Question 16. A patient with acute respiratory distress has the following arterial blood gas: pH 7.22, PaCO 258, PaO 262, HCO 324. This represents: Option A, uncompensated respiratory acidosis. Option B, compensated respiratory acidosis. Option C, uncompensated metabolic acidosis. Option D, compensated metabolic acidosis. The correct answer is option A, uncompensated respiratory acidosis. Question 17. Priapism is a urological emergency characterized by: Option A, painful, prolonged erection. Option B, inability to void. Option C, testicular torsion. Option D, a scrotal edema. The correct answer is option A, painful, prolonged erection. Question 18. The antidote for acetaminophen overdose is: Option A, naloxone. Option B, N-acetylcysteine. Option C, flumazenol. Option D, sodium bicarbonate. The correct answer is option B, N-acetylcysteine. Stressed about your BCEN exam? We can take BCEN exam for you remotely and undetected. We always guarantee a pass and payments only after results. To send us an email, scan the code or tap the link in the description and let's get it done. Question 19. Which pupil finding is associated with uncal herniation? Option A, pinpoint, non-reactive pupils. Option B, a unilaterally dilated and fixed pupil. Option C, bilateral mid- position and fixed pupils. Option D, a constricted, sluggishly reactive pupils. The correct answer is option B, a unilaterally dilated and fixed pupil. Question 20. The clinical finding that differentiates a massive hemothorax from a simple pneumothorax is: Option A, absent breath sounds. Option B, a dullness to percussion on the affected side. Option C, a tracheal deviation. Option D, subcutaneous emphysema. The correct answer is option B, dullness to percussion on the affected side. Question 21. Under the Emergency Medical Treatment and Active Labor Act, EMTALA, a medical screening exam must be provided to: Option A, patients with private insurance only. Option B, any person who comes to the ED and requests care. Option C, U.S. citizens only. Option D, patients with urgent conditions only. The correct answer is option B, any person who comes to the ED and requests care. Question 22. The priority patient for a trauma team activation based on mechanism of injury is Option A. An adult who fell from standing height. Option B. A pedestrian struck by a car traveling 15 miles per hour. Option C. An adult ejected from a vehicle. Option D. An adult with a gunshot wound to the forearm. The correct answer is option C. An adult ejected from a vehicle. Question 23. The safe harbor provision for nurses typically refers to Option A. A law that provides legal immunity in all circumstances. Option B. A process where a nurse can request a peer review of an assignment they believe is unsafe without immediate fear of retaliation. Option C. A hospital policy allowing nurses to refuse any assignment. Option D. The requirement to report all medication errors. The correct answer is option B. A process where a nurse can request a peer review of an assignment they believe is unsafe without immediate fear of retaliation. Question 24. Which laboratory value is most indicative of acute kidney injury? Option A. Elevated white blood cell count. Option B. Elevated creatinine and BUN. Option C. Decreased platelet count. Option D. Elevated liver enzymes. The correct answer is option B. Elevated creatinine and BUN. Question 25. A patient with a history of renal calculi presents with severe flank pain, nausea, and hematuria. The priority intervention is Option A. Forcing oral fluids. Option B. Straining all urine. Option C. Pain management. Option D. Surgical consultation. The correct answer is option C. Pain management.